GERD is gastroesophageal reflux disease. It's a condition that people commonly call heartburn, but it's where irritating and acidic gastric juices regurgitate from the stomach up into the esophagus and cause discomfort and pain. Gastroesophageal reflux occurs when the valve mechanism of the stomach malfunctions, and there's a complex an anatomic mechanism is supposed to close and keep the stomach contents within the stomach. When that malfunctions, then it leads to regurgitation. One of the most common reason is because people have a hiatal hernia. There's a natural opening in the diaphragm where the esophagus, the food pipe, comes through the diaphragm, and if that opening becomes enlarged, then the stomach is able to slide up above the diaphragm, and the natural valve mechanisms then unfold. When that unfolds, then it acts more like a funnel, and the gastric contents then come upstream through that upside down funnel. People who suffer from bad gastroesophageal reflux or bad heartburn, the key word is suffer. Their symptoms revolve around food or the lack of food. And there's a lot of foods that are irritating and painful, such as spicy foods or maybe a person's favorite wine. And people learn to just do without these type of foods. Sometimes physical activities. People are unable to bend over and tie their shoes or pick something up off the ground without having regurgitation and having to deal with that. Nighttime regurgitation is significant. And I interview and talk to lots of people who sleep elevated on pillows at night, sleep in a recliner at night, because if they lay down flat, then stomach contents is going to come back up into their mouth. And so after surgery, a lot of these people are happy because they can lay down and sleep through the night again. TIF stands for transoral incisionless fundoplication, and it's the next generation in anti-reflux surgery. Because this is a natural orifice surgery where the procedure is done with the patient asleep. The TIF is done under a general anesthetic, so it's done in the operating room. The patient is completely asleep, not aware of what's going on, and we pass the operating instruments through the mouth into the stomach, and we do the operation to reconstruct the anti-reflux flap valve inside the stomach. The operation takes 45 minutes to an hour, and people stay in the hospital overnight, and then home after several days of recovery. Most people are back to routine duties and back to work within a week. The TIF procedure is safe, and over the past several years, this procedure has been done in the United States since 2007. There have been approximately 12,000 procedures done with a minimal complication rate. And is it effective? Yes. We know from feedback from our patients that we have many happy patients because their reflux symptoms are under control. There was a recent study published that showed that at 6 months, the patients who underwent a TIF procedure were far superior in their control of their symptoms than patients on daily medication. Personally, I've performed over 100 TIF procedures. There are certain standard evaluations that need to be done to determine if a person is a candidate for a TIF procedure, a hiatal hernia repair combined with a TIF, or if their heartburn symptoms are even caused by gastroesophageal reflux. Usually the routine is a person will come into the office for an initial visit. We'll decide what tests are available. We'll get those done as quick as we can. Then a second office visit, and we'll schedule surgery.